Good question. So not everyone needs to have their wisdom teeth removed. I'd say it really depends on how big your mouth is, if there's enough room for your wisdom teeth to come in. So majority of people do need to get their wisdom teeth removed just because there's not enough room in their mouth. Yeah, so that's probably the number one question that we always get asked. If we don't have our wisdom teeth removed, is it going to cause everything else in our mouth to shift? So that's not necessarily true. I'd say that if your wisdom teeth do not get removed, they can cause other problems that can cause you pain or swelling in your mouth. And sometimes kids will have enough room in their mouth and their teeth will come in. And if they come in a good position, then as long as they can keep them clean, then they don't have to have them removed. But for the most of the time, I would say that patients need to have those addressed and looked at before they become a problem. Yeah, so I think most teenagers are at that age where their wisdom teeth are getting bigger, and you can tell whether there's going to be enough room in their mouth. So by the ages 17 or 18, this is a good time to evaluate them to see if they need to be removed, and you would have consultation with an oral surgeon at that point. Yeah, so everybody gets worried about dry socket, right? And so dry socket is basically just the area where the wisdom teeth were removed, not healing properly. And that can happen for a number of different reasons, so it's really important to follow the directions of the oral surgeon after they get removed. But not a fun thing to kind of go through. There's a lot of things that you can kind of do to prevent it. But in the end of the day, that's a kind of a rare sort of thing to happen, so not to worry. I think it's just really important not to forget about them. I mean, I think that because you don't see them or feel them doesn't mean that they're not going to be a problem. So it's really important to have an orthodontist or a specialist or dentist evaluate them at the proper age, whether it's 17 or 18 years old, to make sure that you're not going to have any problems going forward.